about various causes of diarrhea. Again, like we have discussed in the video of constipation, diarrhea can be acute and chronic. So let's discuss about acute diarrhea first. What are the causes of acute diarrhea? We can divide them as A, B, C, D. 4 causes. Now, A for allergic causes. So if there is any person allergic to certain foods, that can cause diarrhea. Next comes B. B for bacterial infections. Basically, you have to remember, by bacterial infections, we mean food poisoning also. Along with bacteria, you have to remember viral infections, which is pretty common in children and adults with diarrhea. Then comes C. If there is any C for chemical or toxins, if there is consumption of any chemical or toxin that can cause acute diarrhea, like mushroom, then seafood, etc., which can contain the toxins which can lead to acute diarrhea. Now, D for drugs. There are certain drugs which can cause diarrhea. For example, amoxicillin can cause diarrhea, colchicine can cause diarrhea. Many antibiotics can cause diarrhea because they disturb the normal gut flora and can cause diarrhea. Even excess probiotic use can cause diarrhea. Now, let's come to chronic diarrhea. For chronic diarrhea, our mnemonic is I. Yes, every cause starts from I. Number 1 is infections. Chronic infections with Giardia, Entamoeba histolytica, or AIDS. Basically, HIV, human immunodeficiency virus. These infections can cause chronic diarrhea. Secondly comes inadequate absorption. Absorption of what? Absorption of food, digested food particles, or digested simplified food, which occurs in chronic pancreatitis, in case of short bowel syndrome, or in case of bacterial overgrowth in the intestines. So these are the causes which can lead to chronic diarrhea due to inadequate absorption of food. The next I relates to iatrogenic causes, like causes which are caused by the treatment itself, like use of drugs. The next cause may be due to I for intolerance. Intolerance to what? Lactose intolerance. Even in case of insensitivity, like gluten intolerance or insensitivity, can lead to chronic diarrhea. Next cause from I is inflammatory bowel disease or IBD. The next cause is excess ingestion of certain chemicals or certain compounds like fructose, then sorbitol, then caffeine, then other purgatives. These are the compounds, if ingested in excess, can cause chronic diarrhea. Next comes the cause infiltration. What do we mean by infiltration? It occurs in case of carcinomas like pancreatic carcinoma, or you can say gastrinoma or carcinoid tumor. So these are the conditions where there is cellular metastatic infiltration is there, which can lead to chronic constipation, chronic diarrhea. Then comes next cause, that is idiopathic, that is no cause is identified, idiopathic secretory diarrhea. Idiopathic secretory diarrhea. The next cause, which is the last cause from I, is incontinence. Rather, we can call it fecal incontinence. The last cause, which starts from M, only one cause is there, that is metabolic causes. Metabolic causes like diabetes mellitus, here hyperthyroidism. In case of constipation, it is the opposite. Diabetes mellitus can cause both. It can cause diarrhea also, it can cause constipation also. But in constipation, there is hypothyroidism, but in diarrhea, there is hyperthyroidism. Then, if there is any hyperadrenalism, that can also cause chronic diarrhea. So these are the causes that you have to keep in your mind while having a patient with chronic diarrhea. Now, let's talk about the etiological agents in diarrhea. This table might look very scary, but it is not. Let's ease these things up. So diarrhea can be caused by preformed toxins which are already present in the food. These toxins can be produced by certain organisms like Bacillus cereus, Staphylococcus aureus, and Clostridium perfringens. Their incubation period can vary from 1 to 8 hours. Even in case of Clostridium, it can be from 8 to 24 hours. The symptoms will appear after this much time. There is vomiting that is present, abdominal pain is there, fever may be mildly present or not there. Diarrhea, most of these organisms cause watery diarrhea, as you can see. All of them will cause watery diarrhea, except some that we'll discuss. Let's see what other organisms can cause watery diarrhea. Enterotoxin producing organisms like Vibrio cholerae, Enterotoxigenic E. coli, Klebsiella, like Klebsiella pneumoniae, and Aeromonas species. These organisms are having incubation period from 8 to 72 hours. There will be vomiting present, abdominal pain present, and fever will be there mild, and they also cause watery diarrhea. There are organisms which are enteroadherent, that means they adhere with the epithelium of the intestines. These organisms are enteropathogenic and enteroadherent variety of E. coli, then Giardia organisms, then Cryptosporidiosis and helminths, all the helminths. The incubation period may vary from 1 to 8 days. Vomiting is minimal, abdominal pain is present, fever might be present. The diarrhea that is produced by these enteroadherent type of organisms is watery and mushy. Then comes cytotoxin producers. These organisms, they produce cytotoxins like Clostridium difficile, hemorrhagic E. coli. Their incubation periods, they vary from 1 to 3 days, even before that 12 to 72 hours. Vomiting is minimal, but abdominal pain is much more. Fever is there. Now, this diarrhea is usually watery type of diarrhea. Sometimes it may be bloody in case of Clostridium difficile. In case of hemorrhagic E. coli, you can see the name itself suggests initially watery, but it becomes bloody very quickly. Now, next come to invasive organisms. There may be minimal inflammation with invasive organisms. These organisms can cause acute viral diarrhea like rotavirus and norovirus. Their incubation period is usually 1 to 3 days. Vomiting is present, abdominal pain is there, and fever is there. You can notice in the viral diarrhea, the fever is the most, 3 to 4 plus, according to this table. The diarrhea is watery again. Now we can come to mainly bloody diarrhea. What are the organisms? The most common organism that causes bloody diarrhea is actually Shigella or enteroinvasive E. coli or Entamoeba histolytica. These organisms cause severe inflammation of the mucosa, thus causing bloody diarrhea. Their incubation period is 12 or to 8 days. Vomiting is minimal, abdominal pain is very much there, fever is very much there, and bloody diarrhea is there. If you look for variable inflammation causing organisms like Salmonella, Campylobacter, Aeromonas species, Vibrio parahemolyticus, and Yersinia, their incubation period may vary from 12 hours to 11 days, and they cause abdominal pain, fever mainly, vomiting might be there, and they cause watery diarrhea or bloody diarrhea. They can cause both. So, this is all about the etiological agents of diarrhea. Thank you for watching. Hope this helps.